But right now I want to pivot into something medical. You've heard about Ozempic, right? Have you seen the ads for Ozempic? It is a treatment for diabetes, but off-brand. It has been embraced for weight loss. It is somewhat of a miracle drug, if you will, for those in the Hollywood set or the TikTok world. It has gone viral, and it has caused some issues for those who really need it. And more you're hearing of people who are using Ozempic to help with weight loss because it does seem to work. Well, how does it work? And what does this mean for people with A1C type 2 diabetes who actually really need this medication? We want to connect now with the medical director for BC Diabetes. Dr. Tom Elliott is on the line. Thanks for being with us, Doctor.
Hi, Jody. It's so exciting chatting with you. Of course, I know you as the world's best sports host. And so it's...
Thank you.
I
love my time covering sports, but right now we got to dig into like the give me the play-by-play on Ozempic, Doc.
Okay. Well, this class of drug, Ozempic's a member of the class of drug called the GLP-1 receptor agonist. They've been around about 10 years, and it is the latest one, and it's the best. It's widely used for type 2 diabetes, where it lowers sugar and weight. And as you mentioned in the intro, it's also widely used for people who don't have diabetes because it's so darn effective. So it's a once-a-week shot, and it lowers weight by an average of about 5% for people who take it. So, your listeners can do the math. 5%.
Yeah.
They're going to lose 1/20th of their weight on average. Some people will lose a whole lot more. And it is dose-dependent, meaning that if you give more, you get more weight loss. So in the United States, the non-diabetes dose is 2.4 milligrams a week. We don't have that dose formulation here. We have 1 milligram a week for diabetes. But of course, you can switch it and increase the dose. It's very expensive. It's about $7 a day at the 1 milligram dose.
Okay.
So you can
is it injected?
If you want, yes.
When you say
injection,
okay.
It's a very simple injection. In fact, I have, BC Diabetes has a YouTube channel, and my most popular video is showing people how to inject Ozempic.
Really? Wow.
Yes.
That's something. Okay, well, doctor, so it does work. It works for people with A1C type 2 diabetes. It also works for people who struggle with obesity. I actually had somebody reach out to me on my social media explaining how they had been struggling for 30 years to manage their own personal weight struggle. He had identified as somebody who considered himself or has been physically diagnosed as obese. And Ozempic has been a game changer, a life changer for him because it does work. But what does this mean for access for people with diabetes, not being able to maybe fill their prescriptions because of the off-brand use for weight loss?
Yeah, there's been a lot said about that, but in fact, it doesn't seem to be a factor. I think very briefly in late November, there was a shortage in Canada, but that's gone now. So
excellent.
Nobody's missing out on Ozempic who wants or needs it.
Excellent. That is such great news. I love debunking the myths that are like the hot headline clicky bait things. So now let's talk about what Ozempic, is like for a patient or for a person who decides that they want to use it for whatever reason. Are there side effects? Are there safety issues to be taken into consideration with use of this drug?
Okay, so I tell my patients that 1 in 10% of people can't take Ozempic because it causes nausea and vomiting. Oh. And that's if you take it correctly. Taking it correctly, you start with a small dose and you double it every month for three doublings, and you're on the full dose.
Right.
Some people just cannot take it. So, if you talk to people who end up on a full dose of 1 milligram a week, they'll tell you that they feel different quite immediately. They feel a bit different. And if you dig down on it, they'll say that, maybe there's something in their stomach. So a lot of people do feel slightly different, but very few people stop it because of that feeling of different. People lose their interest in food. I run a diabetes center, and I can tell you, we write huge numbers of prescriptions, and people who don't have diabetes take it for their, to reduce their waste, and they'll tell you that the feeling is immediate. They're less interested in food. They walk past food they would normally consume.
Right.
It's so 10% can't take it. The other 90% can. And it's just to slowly increase the dose to find the dose that gets you to your target. So in diabetes, the target is a combination of sugar and weight. For people who don't have diabetes, it's typically a weight target. They need to stay on the drug to continue to have the effect. So once you stop it, it doesn't cure obesity. Unless you continue to restrict your calories.
Right. It's a maintenance. Maintenance is not long-term if you stop using it.
Exactly. So it has two obvious effects. One, the main effect is suppression of appetite. So just less interest in food in general. And then the second effect is to delay the emptying of the stomach. So people feel fuller for longer. So the feeling of fullness is going to last longer than usual.
Interesting. So are there any risks associated with this? Are there, long-term side effects? I mean, we spend so much time talking about, side effects with vaccines and what have you, and long-term risks with any medication. Are there any associated with Ozempic, or is it pretty benign in that way?
Well, experimental rats get thyroid cancer. That's not a problem in humans, so I'm forever reassuring my clients that that's not a risk.
Right.
So really, there's no, there's a very slight increase in gallstones and stuff like that, but nothing that I think should prevent people taking the drug. The decision's going to be made philosophically. It's going to be made based on affordability, etc.
Right. So we're with Dr. Tom Elliott, medical director at BC Diabetes. So obviously, if somebody is diabetic and requires this medication, pretty straightforward, as you said, to have a prescription written for them. But for somebody, let's just talk about it in BC, here, as opposed to in other jurisdictions across North America where it is flying off shelves, apparently. What is the process like for somebody who's listening right now saying, you know what, I'd like to give this a shot. I've struggled with my weight for a long time, and I'd like to give Ozempic a shot, pardon the pun. Is that just a go to your GP and ask for it?
Yes, I think so. It's off-label for people who don't have diabetes. Off-label just simply means that it's not approved for that use by Health Canada.
Right.
So the physician, if you're a Dudley Do-Right doctor who's never going to do anything outside the box, then the doctor may not agree to write that prescription. But most doctors, I think, would be happy to write it off-label for weight loss. Clients can come with information to help support their decision. There are scientific publications showing that it's safe and effective in people who don't have diabetes. So I don't know, you could Google something and show your physician in case they were reluctant.
Right. So again, you said it was about $7 a day. You take a weekly shot? Yes,
weekly.
Okay, so about $50 a week. And you have to continue to use it, or it's kind of similar to any quote unquote diet. While this helps you to feel full and the food exits your stomach more slowly and it manages your blood sugar, all the things that help with A1C type 2 diabetes, but also would help with weight loss. If you go off that weekly shot, the rebound effect could be similar to that of going on a carbohydrate restrictive diet or a real caloric restrictive diet and then returning to your old ways. It's not going to, you can't maintain this without continuing to take it.
That's absolutely right, Jody. So yeah, and it's such an important point for diets in general that when you lose weight, at your new lower weight, you require way fewer calories to maintain. So you go on your diet, you hit your target, and now you've got to continue on a slightly less restrictive diet to maintain. Yeah, and that's the most difficult piece. You know, we're eating machines. We've evolved as organisms,
Consumers.
as animals. Yeah. We're genetically programmed to eat. So
yeah, we are.
We don't respond well to restriction of calories, particularly when they're abundant and inexpensive.
Yeah. Especially when the most nutritious and low-calorie foods are likely often the most expensive ones. It's very cheap to eat the junk food. Dr. Tom Elliott, we appreciate your time today and enlightening us on Ozempic. One huge takeaway here is that it's not in short supply for those who need it, with those who have diabetes. So we appreciate you debunking that myth for us.
Thanks a lot, Jody. Bye-bye.
Cheers. Have a great day. That's Dr. Tom Elliott, the medical director at BC Diabetes. Okay, that was very informative. I saw an associate of mine, someone who I met late last year. I met her in November, and then I saw her again in late January, and she was taking Ozempic. She had lost 35 pounds between November and January. I was shocked, stunned by it. She said, yeah, you know what? It was a little bit to get used to, but now, you know, I just kind of eat the appetizer portion instead of the main course. And I feel full. And there you go. If you're watching people in dropping dress sizes or dropping their belt buckles to a new low, perhaps it is Ozempic. Who knew?